This is Brevard Watch, the news experience focused exclusively on Florida's Space Coast. This is Brevard Watch. I'm Matt Reed. My guest today is Dr. Louis Joseph, a psychiatrist with Parish Health Network. He's worked with Brevard Public Schools leaders as part of a mental health task force in North Brevard, following a series of student suicides and, of course, national reports of student violence. He also is joining Brevard school leaders on a trip to Tallahassee to ask our legislators for more mental health spending in schools. Dr. Joseph, thank you for joining us in the BPS TV studio today.
Thank you, Matt, for having me today.
Well, let's talk about this trip. Brevard Public Schools student government leaders are going to Tallahassee. They are supporting a bill that would increase spending on mental health in our schools. What do you make of that?
When I first heard about this, I was quite impressed. BPS is doing an excellent job of molding the future leaders of our community. I also think it speaks volumes to the efforts towards destigmatization of mental illness here in Brevard. As many people probably are aware, there's a high degree of stigma associated with mental illness. But over the past several years, in the context of numerous suicides, a lot of grassroots efforts and formal efforts, even within the school system, to destigmatize mental illness have been underway.
So you think that stigmatizing, or the stigma of students who need mental health, is one of the things that has been a barrier up to now, either for families and students stepping forward or for providing the services?
Yes, it in essence deters people from coming forward. There's a certain degree of shame associated with mental illness.
The legislature, if it said yes and decided to appropriate, let's say $100 million for schools across Florida to increase the professionals who are available to students when they need help, what would those services look like? What would be the best approach?
I think when one goes about thinking about how to appropriate funding to get optimal health outcomes, I think one should hearken back to a public health framework and really the three categories or levels of health promotion / disease prevention. Those three categories are as follows. The first is primary prevention, which essentially is any intervention to prevent a disease from occurring. So things like vaccinations, encouraging healthy diet, exercise, so on and so forth. After primary prevention, you have secondary prevention. Secondary prevention is anything to detect the disease early on and that leads to prompt treatment. So this is why whenever you go to your doctor's office, they check your blood pressure. Even though you might not have a history of hypertension, they want to determine whether or not it's starting to evolve. Other examples would be monthly testicular exams that are recommended and self-breast exams for women. Finally, you have tertiary prevention, which is any intervention that is aimed at decreasing the devastating effects of a disease. So a great example would be speech therapy after someone has a stroke, or using clot-busting medications immediately after someone's having a heart attack. It should be really no different for mental illness. The approach should be the same.
So what you're suggesting is something along the lines of focus first on preserving wellness, and then when somebody does have a problem or a crisis, there is somebody there to help with an intervention of some kind of strategy and service.
Not necessarily. I guess what I'm suggesting is to look, if Brevard Public Schools was appropriated X amount of funds from the state government, they would want to systematically go through all of their services and the services available in the community to determine as to what degree at each one of those levels of intervention is met within our population. And then when there is a need, whether it be at the primary level, the secondary level, or the tertiary level, go about strategically using that funding at the level that's needed.
But it sounds like something, you need a professional who knows what they're doing, that is there as the resource for some of the kinds of things that we've seen become problems with students and mental health in our schools.
Absolutely. And Brevard Public Schools is really, I guess, reaching outside of the school system, if you will, and partnering with the healthcare establishment as we walk along this journey together for the betterment of the children.
You got involved with this mental health task force, and apparently one of the impetuses for that was a spike in student suicides. It's hard to know when you go from, 1 or 2 per year to 7 or 8 per year, what that means statistically, but it clearly got a lot of people concerned. Were there any patterns that you see or common causes of the suicides that we have had in Brevard Public Schools?
Yes, in the research that we've performed, a couple of trends have emerged. One trend, to no surprise because it's a similar trend across the nation, is most of the completed suicides in Brevard are by way of more lethal means, that being firearms and hanging. The other anecdotal trend that we have noticed in the research we've been doing across various organizations and institutions is the vast majority of individuals who complete suicide in Brevard, including children, have not been touched by the mental health care system and or not in mental health care in the months preceding the suicide. And what this tells us is that in our community we need to develop a more sensitive mechanism in order to detect those that are suffering and get them into treatment.
Well, when we come back, how school and community leaders are responding to that increase in student suicides.
At Community Credit Union, we are always looking for ways, big and small, to make your life better. Manage your accounts online, anytime, anywhere, with eBranch Online and mobile services. Use your mobile device to check your balance, make a deposit, pay bills, apply for a loan, and more. It doesn't get any more convenient than this. Search for the CCU mobile app on your device and download it for free. At CCU, bringing you better options matters. Find out more by visiting ccuflorida.org.
This is Brevard Watch. I'm Matt Reed. My guest today is Dr. Lewis Joseph, psychiatrist with Parish Health Networks. We're talking about student mental health today. Dr. Joseph, you talked about a concept of healthy coping for students and why students need to learn it. Explain.
Well, one could certainly classify coping on the degree of relative adaptiveness in one's life. In the mental health care establishment, we've been doing this for well over 50 years. A prominent early example of this would have been some of the work by Anna Freud, the daughter of Sigmund Freud, who wrote extensively on the topic in the 1960s in the psychological underpinnings of adaptive coping. In essence, some forms or means of coping are more adaptive than others. Take, for instance, say alcohol, drug use, or even cutting. Those are relatively maladaptive forms of coping and certainly can lead to trouble for a lot of people. On the other end of the spectrum, two examples would be, say, for instance, talking to another person when one's in distress, or playing sports, or prayer even. Those don't necessarily get people into the trouble that the former mentioned methods of coping that I mentioned can. So that said, not only do students really need to learn healthy coping, I believe that all of us do.
So life is a series of problems and stresses and challenges that we have to get through. If your way of coping with those things is something that's damaging to you and your body, that's not a great way to get through life. And so learning to deal with it in a more healthy way is something that we all need to learn at that stage of life when we're learning everything else, it sounds like.
Absolutely.
So right along with history and math and science, we ought to be learning how to deal with life psychologically.
Correct.
One of the issues that also I know you've discussed is pediatric depression. What should parents look for, either in pediatric depression or some of the other? I mean, I suppose it must be depression that leads to suicide in most cases as well. But I think there's probably a lot of parents watching this just wondering what kind of clues should I be looking for with my child to help keep the worst from happening.
Sure. Well, pediatric depression typically affects kids in their adolescent years, but can occur earlier. The symptoms diagnostically are no different than adult depression, but kids can sometimes manifest depression differently. And some warning signs that parents need to keep an eye out for that are easier to spot are things like changes in grades, and I'm not talking about going from D's to A's, but from A's to D's. Things such as drug use, starting to ignore their hygiene, fighting, irritability, trouble sleeping, or their child might come out and say that, "Hey, Mom, Dad, I'm depressed," or "I'm thinking about suicide."
Those are the worst case scenarios, is somebody who's going to either kill themselves or might harm others. Do you think that, and I don't expect you to be an expert on rampage shootings and other school violence, but is that the kind of thing that you might see in an extreme case of depression for a student?
Depression is a mood disorder, and it can lead to certain degrees of impulsivity. So it would not be surprising to find that in some of these rampage shootings, if not all of them, the individual had some form of diagnosable mental illness.
We've had fewer than a dozen suicides. That's still way too many. I don't mean to cast that issue aside, but substance abuse has got to be a much more widespread problem. You had a comment in an interview with Florida Today that I thought it really caught my attention. You said that, quote, substance abuse disorders and depression, just those two illnesses, and the disabilities caused by them far supersede all cardiovascular disease and cancers. Really? I mean, there's so much money. There's whole societies dedicated to hearts and cancers, but our other significant problem appears to be these?
Yes, Matt, it's quite amazing. And the WHO, World Health Organization, has researched this extensively. And this is what the literature shows. And it's amazing that such a fact isn't more widely known throughout society. I think with the acknowledgement within our society today of the opioid epidemic, we're certainly moving in the right direction, but I think we have a ways to go.
The opioid epidemic here in Brevard is pretty significant. I know that in your work as a psychiatrist, you've dealt with some institutional work. How bad is it here? Do you know?
Statistically, I could not tell you, but I have worked in other places, and we see the same type of addiction here in Brevard that we do in inner cities. There's a lot of opioids floating around. In order to successfully tackle it, it can't just be the healthcare establishment trying to address it. It really takes a multifaceted approach.
And that takes us back to those healthier coping skills in the schools and help, getting kids to deal with their stress and their problems in a healthier way than with substance abuse or some other issue.
Absolutely, absolutely.
Well, when we come back, an insider's look at two programs already working on mental health issues in our schools.
At Community Credit Union, we are always looking for ways, big and small, to make your life better. Manage your accounts online, anytime, anywhere, with eBranch Online and mobile services. Use your mobile device to check your balance, make a deposit, pay bills, apply for a loan, and more. It doesn't get any more convenient than this. Search for the CCU mobile app on your device and download it for free. At CCU, bringing you better options matters. Find out more by visiting ccuflorida.org.
This is Brevard Watch. I'm Matt Reed. My guest today is Dr. Lewis Joseph, a psychiatrist with Parish Health Networks in North Brevard. And we're talking about student mental health. Dr. Joseph, again, thank you for joining us in the studio today. The Mayo Clinic has some programs in Brevard County. I'm not familiar with them. I could use some enlightening here. The Inside Out program and the Sources of Strength program are two school-based wellness programs that I guess they're already working or underway. Tell me about them.
Well, those are two school-based wellness programs that are already implemented within some of the schools here in Brevard. Only one of them was developed by Mayo Clinic researchers, which is the Inside Out program. Sources of Strength was developed by a group in the Dakotas and in conjunction with University of Rochester in New York. Both of these programs aim to tackle mental illness by way of primary prevention and secondary prevention, as we discussed earlier. Inside Out has more of a focus on changing the culture within schools, improving coping, and strengthening all students' social support networks. These are protective things against suicide and depression. Inside Out takes a different avenue to address some of these issues. It has more of a focus on destigmatization, improving health literacy, and healthy behaviors by way of the content and the form of what's taught in the classroom. Two very, very effective programs, in my opinion, both complementary to each other.
So let's go back to this trip that the student government leaders are making to Tallahassee. They're asking for money. If a lawmaker were to say, yes, I'll vote yes to appropriate money for more mental health services in schools, these might be among the things that money could help stand up and extend to more campuses?
Absolutely. Absolutely.
And who executes these programs? Is it a combination of mental health professionals and the principal of the school? How does it get done?
It's, again, a multi-institutional approach. So it does require collaboration between the program developers / researchers, with the healthcare establishment and the school system.
You have mentioned that we need to look at student mental health as being more than a school problem, more than an issue that one group like Parish could come in and help with in our schools, that it's more of a community issue that requires more stakeholders. What do you mean by that?
Well, according to CDC guidelines and the kind of their recommendations on how one could address suicide in a community, it's not just one institution that is called for. It's a cultural issue in a sense. There's so many factors that come into play to lead one to commit suicide. Take, for instance, the economy. Oftentimes when the economy goes downhill, depression goes up, suicide goes up. When one thinks about an issue such as the economy, there are so many different domains and things that affect it: political, geographic, financial, so on and so forth. I think the CDC's done an excellent job of trying to distill a lot of the active factors that ultimately can culminate in mental distress into their guidelines. And these are the very same guidelines that the Youth Mental Health Task Force is using here at Brevard. And there's numerous members from Brevard Public Schools on this task force, along with many other community leaders.
I'm going to throw you a curveball here. I was watching a lecture, it was a video lecture, but it was about how students and their coping skills aren't the same today that they might have been before social media. Whereas before, people had spent more time face-to-face cultivating friendships, and those relationships were what carried them through some of the tougher times. Today, people may have more relationships according to the numbers on their smartphone, but those relationships aren't the kind of meaningful ones that are there to help people through difficult times. That's what this lecturer said, but he was an educator. As a psychiatrist, what do you make of that?
Well, I think over social media, it's a little bit more difficult to connect with someone on a human-to-human level than it would be in person. Okay. I think most people would agree with that. However, this is a new day and age, and this is how many people cope. And this is the source of many people's social support. And I'm of the opinion that technology is not going to go away. Social media is not going to go away. We need to, instead of seeing it as, I guess, a threat to coping, to try to incorporate it into the repertoire of how one can go about coping and how one can reach out to another individual when they're in need. Say, for instance, if someone lives on their own, maybe far away from other people, and it's 2 a.m. and they're having a really, really rough night, how do they reach out?
That's a great point. And I think looked at from another type of situation, there have always been students who were angry and made threats to go, harm other people on campus. Today, they do it in social media. Other students spot that, report it, and people act quickly on what is clearly could be a cry for help, or it could just be an honest-to-goodness threat. But in that case, the social media helps and is seen as a supplement to the human interaction.
Precisely, and very, I guess, progressive organizations such as 211 here in Brevard have understood that, and they're starting to incorporate text messaging in some of their crisis support.
In general, there's been a lot of focus by our superintendent and school board on helping support the social and emotional health of students, even if it's students who are just hungry and acting out when they're coming to school. What do you make of that in general? Is it just too touchy-feely, or is that really the kind of thing that might lead to some better results in our schools?
Matt, I think it's absolutely spot on. I was very, very impressed with not only Dr. Blackburn and his administration, along with the school board's emphasis on social emotional health within the past couple years. Without mental health, I don't think there is health, and certainly without mental health, there's no learning. We've learned in neuroscience that an emotionally, mentally distressed brain doesn't learn well. And so not only does mental wellness lead us to live happy lives, but also to lead lives where we can optimally learn.
What's a good day for you? What do you consider to be an on-the-job success that you go home feeling satisfied about?
Perhaps in the recent month, one of the best days for me was when I was observing one of the sources of strength trainings here at one of the schools, and watching all of these children here learning healthy coping with the expressed intent to go out and spread that amongst their fellow students. I think as a doctor, I can treat one patient at a time, but the power of such, public health interventions really, really just delights me, and it really, really gets back to why I actually went into medicine.
That is great. Well, we'll have to leave it there. My thanks to Community Credit Union for sponsoring Brevard Watch today. My thanks also to our guest, Dr. Lewis Joseph from Parish Health Systems. We'll see you right here next week on Spectrum Channel 496 and, of course, on YouTube, #BrevardWatch.
At Community Credit Union, we are always looking for ways, big and small, to make your life better. Manage your accounts online, anytime, anywhere, with eBranch Online and mobile services. Use your mobile device to check your balance, make a deposit, pay bills, apply for a loan, and more. It doesn't get any more convenient than this. Search for the CCU mobile app on your device and download it for free. At CCU, bringing you better options matters. Find out more by visiting ccuflorida.org.